Hi, APA and Next Step dancers, families, and staff. Thanks for hopping on today to listen to me talk about ankle injuries in dancers. My name is Sarah. I'm an athletic trainer and physical therapist. I worked in a variety of settings, ranging from youth to the elderly population, and with a variety of different athletic abilities. First thing I want to say today is this presentation is for general information only. I want you to have as much information as you can so that you know how you should help your dancer manage their injury. This is not a substitute for professional medical advice, diagnosis, or treatment. So if things are seeming weird, get them to somebody in the medical community that can get eyes on them and really make sure that they're getting the best care possible. Quick rundown of what we're going to talk about today. We're going to talk ankle sprains, management of those ankle sprains, some common tendon dysfunctions, and then how can we prevent and treat injuries. So looking at the meat and potatoes of why you decided to listen to me talk today. If we look at dance injuries, 77% of these injuries are going to occur in the lower body, so from the belly button down. The foot and ankle are the most commonly injured area of this entire area, regardless of dance style. So hip hop, ballet, acro, they are all going to place an increased risk on foot and ankle in our dancers. The Ottawa ankle rules are a screening mechanism that I use a ton when I'm covering youth athletics. It's a good way for me to help guide parents on should we take our kid in to get x-rays done. So say the dancer has an injury, whether it's at school or during a class, and they are saying that they have pain in the green area of these two pictures. That's going to prompt us to pull out the ankle rules to determine what should we do next. The first two components of this screen are going to be bony screens. So we're going to start on the outside of the ankle. We're going to find that lumpy, bumpy guy and poke right on the tip. Is it tender? If not, you can start working your way up about 2.5 inches along the backside of that bone. Again, screening for that bony tenderness. Next, we're going to look at the inside of the ankle. This bony area tends to be a little less prominent, but still pretty visible. We're going to look, do they have bony tenderness right on the tip of it? And then moving up again 2.5 inches. If those are both negative, we can then move on to the next of the screens, which is going to be their ability to walk both immediately after the injury and then at the time of evaluation. So we're looking, are they able to take 4 steps? They don't have to be pain-free steps. They don't have to be pretty steps, but can they put weight on the ankle? If they're able to, we can say pretty safely that they don't need to be rushed to get an x-ray. If they're not able to put weight on the ankle, though, that would prompt us to believe that there is a high risk for fracture, and we want them to get screened. I will say, these screening tools are much, much more accurate in our bigger kids. Our littles tend to get really worked up when they have an injury, and they're going to be less likely to be able to explain what they're feeling. So use this as you're able to, but with the knowledge that we may not be getting the best of the pictures. So we've ruled out a fracture. What's next? Either they went and got the x-ray and it was negative, or you did the Ottawa ankle rules and it was a really low risk, so you weren't concerned over that fracture. We are going to go through what's called price. The first stage of that is going to be protection. Pop on an ankle brace, use crutches if the kiddo is limping a lot, maybe a walking boot in more severe cases. That's just going to keep that ankle safe and lead to it not continuing to get grumpy with every step we take. Next is going to be rest, starting with complete rest, not putting any weight on the ankle, and then progressing into relative rest. So maybe they're able to do some choreography where their feet are kept on the ground, but they're not doing any leaps or turns at that stage. Throughout the entire time that we're rehabbing an ankle, we want to make sure that we're icing regularly, 15 to 20 minutes, a few times a day. My personal preference is to do an ice bucket because of how curvy the ankle is. It really allows us to get maximum contact between the cold substance and the ankle. If you choose to go the ice bucket route, I would say to go a little less on the duration, so looking more like 10 minutes versus that 15 to 20. We want to look at compression as being an option as we're treating an ankle sprain, either an ACE bandage or a compression sleeve, something that's just providing a gentle hug to the ankle so that we are limiting the amount of swelling that is building up in the area, but still allowing blood flow and sensation down to the toes. Finally, we're looking at elevation. We want that foot elevated as often as possible, and ideally, we're elevating it above the level of the heart to allow that swelling to drain down through the leg and not sit in the foot and ankle. Next, we're going to talk about recovery. Looking 48 to 72 hours after the injury, we want to start getting the ankle going again. The first thing I always guide patients on is going to be range of motion. Motion is lotion. If they cannot move that foot and ankle through their full range as compared to the other side without pain, that is going to lead them to have difficulty performing any dance skills. So trying to restore that as quickly as possible. Next is going to be strength. We want to strengthen the ankle so that it has good stability and we're able to perform all of the moves in a complete mechanism. And then finally, balance, especially single leg balance. Dancers require such awareness of where they are in space, and that goes all the way down to the foot. So that's going to prevent the risk of re-injury, but also making sure that they have the entire activity tolerance for their dance classes. Here I put together a scene of exercise programs starting with phase 1, moving to phase 3. Phase 1 is going to be more motion, phase 2, a little bit more strength, and then phase 3 into that jumping and balance style of activity. The goal would be that you're performing phase 1 for 2 days without pain before proceeding to phase 2. Now, say you start to have pain while you're completing phase 2, it is entirely fair to regress to phase 1. Again, these are not comprehensive. These are not athlete specific. So use them as a tool, but know that if you're not progressing, you're continuing to have pain, we would want you to seek out specific medical intervention by seeing either your primary care provider or a physical therapist. Next, we're going to look at tendon injuries in dancers. These tend to be due to overuse, and it's tough because dancers are really one of our earliest specializers in the athletic world. In baseball, we use a pitch count to protect those kiddos' elbows from having tendon dysfunctions, but there's not really the same metric in the dance world. We can't say that doing 120 releves in a class is going to lead to an overuse injury because we don't know that. And even in the research world, they're not seeing one specific measurement of how we can assess this. These are the 3 common foot and ankle tendon dysfunctions. The first is going to be at the Achilles tendon. So that is running from the heel in the back of the ankle up into the calf muscle. It is commonly injured due to our landing mechanics because as we land, that tendon is being stretched across the heel and it's absorbing a lot of force. It also is going to be commonly injured in dancers that are performing a lot of demi-plie and grand plie because of that same elongating mechanism. It's less forceful, but it's still a lot of elongation that's happening. So if a dancer is having pain in the back of the ankle from the calf down to the heel, it's painful for them to raise up onto their toes or point their toes, we can start to believe that they might have some Achilles tendon dysfunction. The next is flexor hallucis longus tendon dysfunction, or FHL tendon dysfunction, as I'm going to call it, because that's just less of a tongue twister for me. In my world, we know this as dancer's tendinitis just because we see it so much more in the dance world than any other population. This is going to be the most common in our dancers that are dancing on point, just because we're loading through that big toe. It is going to present as pain on the bottom of the foot, anywhere from the heel to the big toe being the most common site. And finally, posterior ankle impingement. This is kind of the cousin of FHL tendon dysfunction because they happen together quite often. They don't have to happen together, but I just want to raise that awareness. This is going to be really deep pain in the back of the ankle. It might feel like a pinching sensation. It is going to be painful when we actively point the toes, which is tough because that's similar to Achilles tendonitis, but it's also going to be painful if somebody moves that foot into that toe down position. And that's going to lead us to believe more of the posterior ankle dysfunction versus Achilles tendon dysfunction. Just like with our ankle sprains, I put together a few treatment ideas, again, not specific. If we have a dancer that is having a tendon dysfunction, there is likely an energy leak somewhere else in the body. It could be the hips, it could be the core, and it'd be good to get that screened. Sometimes we just don't have the time to do that and we want something that we can quickly start. So these would be some ideas. With these, If the ankle pain is getting worse, we definitely want to move a little quicker on getting into the primary care provider or a physical therapist for some specialized treatment. Now we're going to talk about preventing tendinitis. It's not listed here, but the most important thing we can do is make sure that we are getting proper calories. Nutrition is going to prevent our body from going into an energy deficient state where we're going to have to break down internal structures to come up with that energy. So making sure kiddos are getting good calories during the school day, but then potentially while they're at the studio if they have multiple classes in a night. First listed here, though, is going to be our warm up and cool down. So we want to start with gentle movements and then make sure that we're getting more dance specific and especially which style of dance we're doing. Doing a ballet warm up for a hip hop class isn't going to be as good as doing a hip hop warm up for a hip hop class. And then the same at the end of the class. We want to make sure that we are cooling our bodies down, bringing them back down to our baseline temperature after working so hard. This is a huge reason that Miss Alyssa always wants our dancers dressing appropriately for the weather. If we bring a cold body into the studio, it's going to be harder for us to warm them up and prevent injuries. And then with leaving, if we take a warm body and cool it off really, really fast, they're at an increased risk the rest of the day of their tendons having some type of dysfunction. From there, we want to look at how the class is built. That is going to be building from slow intensities, smaller movements to bigger intensity, bigger movements, with the highest intensity being at the end of a class or a practice. I don't see this so much as being a problem in our teacher-led classes, but when we have dancers that are going in and they are doing some choreography on their own, maybe posting it on social media, we want to make sure that they don't learn the choreography one day and then quick hop into a studio and try to go full out without a warm-up and building their intensity, just to make sure that we're not injuring those tendons. Third is going to be proper form. I know a lot of times it seems like form is all for the audience and the judges because of the aesthetic side, but it truly is dancers, the teachers looking out for you and your longevity of your dance career, whether that is through the studio, moving into college, or higher level programs. We want to make sure that you are loading your tendons and joints safely. So taking that feedback and really being aware of how you are loading through your body. The final thing we can do is going to be strength training. Ideal strength programs are going to start a few months before the dance season, but even a few weeks can be beneficial. We want to use a strength program that's going to be heavy on the core, heavy on the lower body, and definitely some upper body strength so that our upper body can assist in certain positions. This strength training program should be done 2 or 3 times a week consistently to allow us to build up that strength, and then maybe continuing in some capacity as we're more dance specific, just to allow our bodies to continue to have that stability. That is all I have for you today. Thank you for listening. If you see me around the studio, make sure to say hi, and I hope this was helpful to everyone. Have a great day.